other ways where you may diagnose this, and that would be, number one, doctor, an ultrasound.
So the ultrasound is what we call our mainstay of diagnosis at this point.
Okay.
This is what you see here is a normal carotid duplex ultrasound, and if I had a duplex ultrasound, I wish mine looked like that, because this is normal blood flow. You see how it is regular, it's uniformly red. There is a way to measure velocity, and the way I explain it to my patients is like a river and a rapid. When the river gets tight, the water goes faster. That's what we measure with duplex ultrasound. We measure how fast the blood is going through an area of potential stenosis. And when these velocities here start going up, let's say this 80 was 350, and the diastolic of 30 was over 100, we would reliably say at that point, and assuming that the duplex ultrasound is done in a good lab with a fair amount of experience, we would say at that point that there is a degree of carotid stenosis that may be significant. There are more specific ways of measuring, and this is, by the way, a specimen. It's an actual carotid plaque, and this is what it looks like. Very interesting to see. These are the lipid depositions in here. This is what we were talking about, Olga, about cholesterol and lipids
correct.
being deposited. And this is the way the body is trying to wall that off, to sort of put it aside by trying to enclose it in this fibrin plaque. And this dynamic process keeps going on throughout our lives. But another way of making this diagnosis would be, now this is the same plaque, but in a contrast study called the arteriogram. You can see this filling defect in the internal carotid artery that goes to the brain. This would be what we call a critical stenosis with thrombus sitting here. I would be very aggressive with this patient, in terms of their treatment. They will probably need surgery or a carotid stent.